Welcome back to A Slice of Health, where health comes alive, with bite-sized health education to keep you moving and become your own health champion, with stories that heal and knowledge that empowers. But before we jump into our topic for today, I want to tell you a story. Thomas's best friend was diagnosed with HIV last week. His friend called him in a panic, unsure of what to do, who to talk to. Thomas didn't quite know what to say. His friend said that the nurse at the clinic who tested him advised him that this was not a life sentence and explained many details to him about medication, lifestyle changes, and a few things that he would need to be aware of going forward. Thomas listened to his friend, but throughout the conversation, Thomas's heart was racing. Thomas didn't really understand what his friend was saying, and Thomas himself felt that his friend didn't understand what he was saying either. His friend asked if he would follow him to his next nurse's appointment, as well as an upcoming doctor's appointment. Thomas agreed to this, but Thomas still has many questions, and he doesn't feel like he can talk to his friend about these questions because his friend seems to be going through an emotional time at this point. Thomas wants to know if he is at risk, but Thomas also wants to know what all of this means to his friend, especially because his friend also doesn't really understand what this is. Thomas recalls that he has heard the word HIV/AIDS, and to him, that sounds like a big deal and a big problem. He doesn't know what this means. He's confused, and so he's asking us today, what exactly does it mean to have HIV/AIDS? What does this mean for his friends? And does this have any implication on him as a person? Today, we're going to talk about HIV and AIDS. The 1st of December is AIDS Awareness Day. And AIDS Awareness Day is an international day dedicated to raising awareness about AIDS. World AIDS Day is an opportunity for everyone to unite and come together against HIV, to show support to people who live with the condition, and also to remember those who have lost their lives in relation to AIDS-related diseases, and also to commemorate those who fought tirelessly to bring HIV to where it is today by encouraging research and accessibility of medication. HIV stands for Human Immunodeficiency Virus. It's a virus that infects and causes destruction to the cells in the body. When this virus takes hold of the body, it makes the body less likely and unable to fight other diseases in a way that it would previously have if the virus was not present. This means that it can significantly make the immune system weak. And as we know, our immune system is our body's defense system against anything that wants to harm us or cause sickness in the body. AIDS, on the other hand, is something called acquired immunodeficiency syndrome. Acquired immunodeficiency syndrome is the final and most serious level of HIV infection. This means that people who are living with AIDS have gotten to the end of the journey with HIV. HIV does not always lead to AIDS, and this is something that is extremely important. It is not possible to get AIDS if you have not previously been infected with HIV. However, if you have HIV, it is very possible with current treatment not to get AIDS. As I mentioned, HIV affects your immune system and causes the cells that help protect your body to be quite low in number. This means they can't fight off infections. And these infections could be very simple infections, like the flu and anything else that we might otherwise have been able to fight off quite easily. HIV is unique in the way that it works, because it works in a backwards way from the way that normal cells usually do. Once this virus gets into the body, it changes the way our DNA sends instructions to the rest of the body. It kind of does a backwards machinery and backward encoding system onto the body. And so what it then does is it causes the body to make more and more cells that are infected with HIV. HIV can affect anybody that is exposed to it, really. However, it does currently disproportionately affect men who have sex with men. Now, these are not the only populations of people that are affected with HIV, and that is extremely important to be aware of. HIV can also be contacted by sexual contact. It can also be contacted by blood-to-blood exposure as well, such as through an infusion or a healthcare worker that was infected while giving care to somebody who was infected. HIV can occur without someone having any symptoms, which is why if someone is at risk of having HIV, it's important to get tested regularly. However, in certain situations when HIV might initially cause the infection or HIV might initially take hold on a person's body, they might have simple illnesses like a fever, some fatigue, a sore throat, some night sweats. Occasionally there might be a rash. However, like I said, HIV can take hold without any symptoms at all. Now, we come to the final stage, which is AIDS. AIDS, like we mentioned, is the most serious stage of HIV. The stages of HIV are threefold. First is acute HIV, where someone becomes infected. They might have symptoms, or they may not have any symptoms, and those symptoms themselves usually last only a few weeks and disappear completely. The second stage is the stage of HIV being present in the body. This means that someone can live with HIV for a prolonged period of time without being aware that they have it. And the final stage is a stage where HIV has taken charge of the body and it leads to AIDS. AIDS is a very serious condition, and it is defined by the presence of different kinds of diseases that come together to become what we call an AIDS-defining illness. Some of these include thrush of the throat, mouth, or lungs, certain kinds of cancer, certain kinds of inflammation or loss of vision in the eye, the presence of other kinds of viruses, certain kinds of ulcers that last a prolonged period of time. But remember, some of these conditions could potentially exist in someone who does not have HIV. However, you cannot have AIDS without having. Now, he wanted to know if he was at risk of having HIV from his friend. The answer is he can't get HIV from hugging his friend, from using the same bathroom as his friend, from sharing cups or plates as his friend. He can't even get it from donating blood to his friend. However, if he and his friend were in a sexual relationship, then that could increase his risk of developing HIV. HIV, however, in 2025, is easily diagnosed with a simple blood test. And although there is no cure for HIV, there's a lot of treatment that is very effective at keeping HIV under really good control. These medications are called antiretroviral therapy. And these medications are normally simple pills that can be taken on a regular basis to keep blood count under control. What this means is that it prevents the HIV from making more and more copies of itself and infecting your cells. And if you have your HIV under really good control, a lot of people who keep to their medication, adhere to their medication, and maintain good contact with their healthcare provider actually find that they are at limited or almost no risk of ever developing an AIDS-defining illness. Like we said, HIV does not have the capacity to just disappear. However, like we said, if someone takes their medication regularly, even when they feel well, even when their blood tests seem like the HIV is under good control, then it really puts them in a good position to be able to live as good a quality of life as anybody else. The reason for this is because HIV can be latent. And what that means is that it can be very, very quiet until it suddenly decides that it wants to take charge of the body, which is why it's so important to use medication even when a person is not unwell. Now, how do we reduce our risks of getting HIV? Important to practice protective sexual encounters, which means using condoms, latex condoms, whenever having sex, never sharing needles if a person is an IV drug user or uses needles for any medical purposes, ensuring they get tested as well for sexually transmitted infections is really important. Anyone who is at a high risk of exposure to HIV, like we mentioned earlier, can also use a medication called pre-exposure prophylaxis. This is medication that can be used regularly if a person is exposed to higher risk of HIV, and this protects their body from the risk of being infected. So if someone feels that they've been exposed to HIV or they might be at high risk of HIV, then it's extremely important to contact their healthcare provider and have conversations about this as well. So in summary, HIV can be prevented by specific daily habits. HIV can also be prevented by using certain kinds of medication if someone is at high risk. HIV cannot be transmitted by daily habits such as hugging or sharing cutlery or sharing a space in a home. However, HIV can be contacted by sexual contact as well as from receiving a blood transfusion. Remember, HIV is not AIDS, but AIDS is the consequence and a late stage of HIV. As we celebrate World AIDS Day, it's important for us to remember those who have lost their lives to the disease and always encourage anyone you know who might be at risk to take care of themselves and speak with their healthcare provider. And really important to make sure that if you have HIV or know someone who lives with HIV, to encourage them to stick to their healthcare management plan, to take their medications regularly as prescribed, even when they feel in 100% shape. So that's it for me from today. Until I'm back in your ear tomorrow with stories that heal and knowledge that empowers. Bye for now.